there, and welcome to the Institute for Natural Medicine's podcast, The MD Will See You Now. I'm your host, Annalisa, and in this podcast, we talk to naturopathic doctors across North America about their whole person approach to health, what patients can expect, and why their work is so very vital to patient health itself. Today, I'm thrilled, absolutely thrilled, to welcome Dr. Leanna Standish to the podcast. Dr. Standish is a neuroscientist and a naturopathic physician who is board certified in naturopathic oncology, and she holds faculty appointments at Bastyr University School of Naturopathic Medicine and University Research Institute, as well as the University of Washington's School of Public Health and School of Medicine's Radiology Department. She's also the medical director of the Bastyr Integrative Oncology Research Center, better known as BIORC, and has also served as principal investigator on several National Institute of Health research grants and has published widely, and I cannot stress that enough, widely on integrative oncology. She's also provided adjunctive naturopathic medical care to literally hundreds of cancer patients, and it's no surprise that she's a founding board member of the Oncology Association of Naturopathic Physicians, otherwise known as ONCANP. Now, what about her current research? Well, it includes looking at the medicinal mushroom Trametes versicolor in the treatment of breast and prostate cancer, developing integrative oncology outcome studies, and looking at IV therapies as well. And finally, Leanna is the co-founder and co-director of the Advanced Integrative Medical Science, that's AIMS, Institute in Seattle, Washington. And there, they are dedicated to advancing integrative medical care, research, and education within a few fields, actually, within oncology, psychiatry, neurology, rehabilitation, and palliative care. All that being said, such a pleasure to have you here, Dr. Standish. Thanks so much for joining us. So let's dive in. As I mentioned in the introduction, you've been conducting a lot of integrative oncology research. This has been going on for over 25 years, and you've been doing this in many different settings with many different organizations. And as anybody can tell you, as a quick PubMed search will tell you, there's for sure more conventional cancer research out there than integrative oncology research. But in recent years, which I'm delighted to see, more and more naturopathic doctors are actually conducting and publishing research on the patient benefits of including naturopathic care in integrative cancer care. And this covers quite a few topics, but I'll mention a few. This includes, for example, research on reducing adverse effects of conventional cancer treatments like chemotherapy and radiation. It also looks at things like improving survival rates, quality of life, and really much more. So, Dr. Standish, that being said, can you give us a sense of how naturopathic oncology research has really changed over the last 25 years or so? And why should this matter to the public?
I want to thank you deeply for inviting me, because this gives me an opportunity as a doctor to let people out there all over North America, Canada, and the United States know about this wonderful emerged field called naturopathic oncology. And I just want to say what that is before we start. So for me, it means that I'm coming at the patient's cancer diagnosis and treatment plan with an orientation towards quality of life. How you feel is really important all the way through, with the point of view of helping patients make good decisions about what kind of surgery they might consider, or what kind of radiation, what kind of chemotherapy. And we work as a team with medical oncologists. And so the way that I do that in my practice is, if a patient comes to me and they have a medical oncologist that they're already working with, I communicate with that medical oncologist so that we're providing what I call integrative medicine, integrated between these disciplines. And I wanted to talk a little bit about research. So my passion, since I was a little girl, was to discover new medicines for people who are sick. And so I discovered naturopathic medicine actually kind of late in my professional life. And I have been focused on finding out, does the stuff that we use work? And if not, what can we do better? And so my whole life has been focused, especially in my cancer research, on measuring what we call outcomes. Like, you go to a doctor, you get a treatment. Well, what happened to you? Did you get better? And so in cancer, we measure our outcomes by two very hard measures. And one is, did your cancer come back after treatment? Right? One of the humongous fears, if you have cancer and you go through treatment, which is often very difficult psychologically and physically, and then have your cancer come back, there's this fear. It's almost like a black cloud hovering over you because of the fear of cancer coming back. So we've been very focused on preventing recurrence of cancer and developing new methods. I learned from my teachers about certain intravenous therapies that have been used in naturopathic oncology. And I first learned about intravenous vitamin C, which is actually quite interesting. I must say I was skeptical when I first encountered it. But for example, at the clinic I work in Seattle, we're using intravenous vitamin C along with two other natural agents to treat cancer in patients that have early microscopic evidence of recurrence. And one of the things that naturopathic oncologists are really good at is, I think of us as being early adopters of big, good developments in technology. For example, we very early on saw the benefit of this blood test called liquid biopsies, which is a whole field of genetic cancer medicine that's just appeared in the last 10 years, if that. So the research is really, really important. There are more studies of naturopathic oncology, and I'd like to actually turn my attention to the study that we're doing right now, if that's okay. So the study that we're conducting in Canada and the United States is asking the question, if cancer patients with advanced cancer, stage 3 and 4, go to a naturopathic oncologist who is a fellow of the American Board of Naturopathic Oncology and are credentialed, board certified in naturopathic oncology. For those patients who go to those clinics, and we identified 12 of them that could be research sites, what happens to you? And what happens to, and everything that happens to your lab work, your clinical outcomes, how long you live, did your cancer come back, what is your quality of life, and then what treatments did you do, both conventional treatments or standard treatments, and what we would consider adjunctive treatments or additional treatments that naturopathic oncology provides. Most of our patients combine regular cancer medicine, standard, with naturopathic oncology, and it's a beautiful integration.
It certainly is. And thank you for giving us that insight into some of the things that, well, your own passion that you had since you were very young, and how that has factored in to the research that you have done, are doing, and continue to do. I think IV vitamin C is a really great example. There's an incredible amount, and I encourage people to hop on PubMed, hop on Google Scholar, please seek out those studies. There's some very strong research on that. And as I'm also glad that you pointed out that you were speaking about your own patients, but I think overall in the integrative oncology world, as you mentioned, most of your patients are using naturopathic oncology methods in integration with, right? Conventional cancer treatments. And this is a really important point, because there certainly is a bit of a misconception among some members of the public that when it comes to naturopathic oncology, it's kind of an either or, that you do one or the other. And as you're indicating, not only is that not the case, right? People are doing both. They're also benefiting. Patients are really benefiting from this integration, right?
Yeah. I'm thinking right now, I have this lovely patient, a man who's in his mid-50s with very advanced colon cancer, and he's coming into the clinic today. And what he's going to get, because he's dehydrated from chemotherapy, he's going to get intravenous nutrition with us. Because he's in pain, from his surgery and his and postural issues. We're going to give him a massage. We're going to put on a botanical tincture on his sore muscles to get him out of pain. And we're going to do acupuncture for pain management and mood. And as an example of the things that come to bear, and communicating with this patient's medical oncologist at the nearby hospital in Seattle.
Well, that is a beautiful example of the type of integration that you're really talking about, because it's not just one or two things. It's really looking at that, that patient in front of you as opposed to the disease state in front of you, and really seeing what's going to help this person along. I'm very pleased that you brought up this study. And if I may, I'd like to just give the members of the public a little bit more detail on that study. And let's try to dig into this a little bit. So, in terms of the research going on right now, there's certainly a number of studies out there, naturopathic oncology wise, but this particular one is called CUSIOS, CUSIOS, and it stands for the Canadian U.S. Integrative Oncology Study. And there's a few things that stand out to me about this particular one. First of all, it's pretty long-standing. This has been running since 2015, and it's not done yet. And as you just mentioned, this is a beautiful cross-border collaboration between naturopathic physicians and doctors in Canada, where I'm located, by the way, and in the United States. And consequently, there's naturopathic, research and education institutes getting involved on both sides. On my side of the border, we have the CCNM, otherwise known as the Canadian College of Naturopathic Medicine. On your side of the border, we have Bastyr University, which of course we know you have extensive links with. Now, this study is looking at a number of things, as you mentioned. There's these sites that have been identified, 12, I think you said, clinics between Canada and the United States. You're looking at these outcomes, and you're also looking at, digging into the actual treatments that the naturopathic doctors are recommending for the folks in this study that they're using, as you mentioned, alongside these conventional care treatments. And there's even future plans for looking at some sub-studies that are, digging into things like, what is the cost of cancer care? What is the quality of life impacts? And really looking at what is the qualitative experience of care? That's going to be in a subset of Canadian folks. So, what we see here really is a situation where naturopathic doctors, and especially those with the FABNO designation, as you mentioned, that are board certified in naturopathic oncology, you folks are leading the charge on research, which is amazing. So that was a really beautiful example you just gave. And more generally, Dr. Standish, do you have any comments on how this type of research might actually impact the future of patient care? And what about this cross-border collaboration? Why is that important?
Oh, really good question. Well, first of all, CCNM, Canadian College of Naturopathic Medicine, has been a leader in naturopathic research for many years, and Bastyr in Seattle in the United States. So those two organizations partnered in 2015, and we've obtained funding from a private donor in Canada, who is as interested in as we are in, do these complementary and or alternative methods actually work, right? That is the big question. And so what we've done, as I said, is just to collect data from these 12 clinics, extensive data on each patient. And then we've had that data in a big, huge database. And what we're hoping to show is, first, that patients who advanced cancer patients who seek naturopathic oncology care live longer and live better than, well, what? Then what? The comparison group is is always the big issue. We are comparing our outcomes in naturopathic oncology clinics with the data that's published in the United States. The United States CDC, the Centers for Disease Control, has been tracking every single case of cancer in this country for many years. And so that database knows diagnosis, demographic information about patients who've been diagnosed with cancer, their stage, and we're comparing survival in that national database with survival in our patients. And we've started looking at it, and I'm not at all surprised that overall survival is better with naturopathic oncology. Not surprising. But I also am hoping, and I think we're all hoping, that we're going to see a signal for a particular therapy that is particularly effective in, say, ovarian cancer or colon cancer or breast cancer or pancreatic cancer. And then we will use those data to justify what's called a randomized controlled trial. So, for example, let me just say for me, I have hopes that mistletoe therapy that we have learned from German physicians in our field will turn out to be associated with good survival. We're hoping that loco-regional hyperthermia, which is a way of heating up cancer tissue in a non-invasive way, will produce better outcomes. And that therapy is being used by just one of the 12 clinics. Right. So we're hoping that patients receiving high dose intravenous vitamin C will do better than those who don't. So we're going to use that data, hopefully, to ask the federal government, at least of the United States, the National Institutes of Health, to fund a randomized controlled trial of these therapies in advanced cancer patients. And because we now have these marvelous ways of measuring tumor activity in a small blood sample using what's called next generation gene sequencing technology, we can find out whether our therapies are working in just a few weeks as opposed to waiting months. So that's what the hope is. And we started this in 2015. We recruited nearly 400 patients, and we've been following all of them for at least 3 years. So we will be able to report how many of our patients survived those 3 years with life-threatening terminal cancer diagnoses.
Well, I will certainly be keeping my eyes out for the results of this because, as you indicated, really is the question, do these methods work?
Right. And it's been really interesting to me that how this was kind of a shock to me when I first got into this field. I thought every hospital in the world tracks their cancer outcomes, finds out what happens to their patients and reports, their results. And actually, it's extremely rare that even academic cancer centers report on their outcomes. And I feel this ethical responsibility to do that.
You've really pulled together so nicely why this research is so important, because certainly from the public perspective, there is all kinds of research coming out constantly about all types of things to do with all types of cancers. Much of that research is very conflicting, and people do get very confused, and it can even add to their stress burden, I think, just keeping up with these studies and who do you trust and what is legitimate. And ultimately it comes down to, well, as you said, what works, but where's the research that proves that? What is the rigor of that research? And who is actually doing this research? So I'm so pleased that you're bringing to the fore, I totally agree with you. The Canadian College of Naturopathic Medicine has indeed been a leader in many, many types of naturopathic research. And hey, I'd love to speak with you again to find out if the NIH does indeed fund, an RCT. For this, because that would be a really logical and also really impactful, I think, next step. Because one of the things that frustrates me sometimes about naturopathic, or actually any research at all, to be honest, is that researchers spend a heck of a lot of time, big funding dollars coming in, beautiful study produced, and then it sits on a shelf somewhere. And maybe
especially negative studies.
Yeah, especially. And, I really like this idea of the fact that you're doing this research, that it will be useful to the public, and it's not going to be kept behind these academic silos. if I can
Yes.
use that term, and really get out there to the people that it truly affects on a day-to-day basis, and ultimately that it really matters to.
Yes. I want to talk about just briefly one example in this intravenous vitamin C. I want to go back to it because I think what we've concluded here at Ames Institute in Seattle is that there is no doubt in our minds, based on the science and based on our results, that intravenous vitamin C, when paired with certain chemotherapy drugs, enhances the effectiveness of the chemotherapy drug on reducing the tumor size. And so it hurts my heart that this is not widespread knowledge. And the other thing is, until we do these randomized controlled trials, things like intravenous vitamin C will not be covered by insurance, right? By medical insurance, whether it's public or private. And so one of the goals is to do research, not only to find out what works, but to do the research so that third-party payers for healthcare can make wise decisions about what to cover.
That is a really great point, and thank you for raising that, because that is a very practical way, and it's probably something that most of the public doesn't think about when you think about how that research gets used. But indeed, a variety of third-party payers, whether that's private insurance companies or otherwise, that is what they need to change their own policies. They need that data. And until the data is there and it can inform those decisions. So ultimately, one potential outcome of this, as you are, kind of alluding to, is that certain types of cancer treatment options, hopefully in the future, may become more affordable, or at least there may be more avenues by which funds can be related to that. And certainly, there's a huge difference, of course, in our two countries in terms of how the medical system actually works. But I think that this will apply across the board because, certainly private insurance is very, very important here. Not everybody has it. It doesn't cover for, certain types of cancer drugs in particular can be quite expensive. And what you just pointed out is really, really key, that it's not only the fact that cancer patients, and also, might I add, conventional oncologists, I think increasingly are recognizing, right, the benefit of integrating these. But when you give an example like that, that's really impactful with IV vitamin C, that not only are you using these things together, yes, there may be impacts in terms of reducing some of the adverse effects of those conventional treatments. But the most important thing here, in addition to like all of this, is that it's actually making the conventional treatments, the chemotherapy, more effective. More effective. This is huge news for many people.
I have another example. I have been fascinated by brain cancer my whole life. My father died of glioblastoma, which is a quite aggressive form of brain cancer. So I've been focusing on, is there a natural medicine approach to treating this particular kind of malignant brain cancer? And so over the years, I find myself pointing towards curcumin, the molecule that is present in many Indian foods. It's present in the turmeric root, but that molecule has some very interesting anti-cancer properties. And so we're doing a study here at Ames Institute for intravenous curcumin in the treatment of a recurrent brain cancer, GBM or glioblastoma. And I'm so happy to be in an environment where we can ask the question of, can plant medicines be useful in oncology, and do these small studies, but I think significant studies. And then I also wanted to say another thing about navigation. One of the things that is so frightening when you're first diagnosed with cancer, it's usually one of the most frightening things in your whole life, and you have no idea what to do unless you've, had a parent that had cancer. You have no idea what to do. You have no idea what to call, who to call. What do you and so we often the fellows of the American Board of Naturopathic Oncology, NDs, naturopathic doctors, are really good at helping patients navigate to get quick conventional treatment. and instead of waiting. And then the other thing I wanted to add is prevention. Apparently, 1 out of every 2 people in North America is going to get some form of cancer in their lifetime. There's got to be a way to prevent it. And we know many nutritional and exercise methods, but I'm very interested in working with patients who have a family history of cancer, or they have some genetic mutation that puts them at risk, because we're treating those patients and following them to find out if they get cancer or not. If they don't, then our method has succeeded.
Thank you for those points as well. Plant medicine has a great deal to offer in terms of cancer care. Well, we know that ancient healing traditions, such as Ayurveda from India, such as traditional Chinese medicine, otherwise known as TCM, and that is a wonderful thing as well, right? That not only can we draw upon this centuries, really, of these rich traditions, but we can also combine these things into new and modern forms. And you gave a great example. We have this ancient herb, curcumin, and here you are now testing out its use in IV therapy form. So what a beautiful meeting, of these two worlds.
Mm-hmm.
Well, to wrap up today, Dr. Standish, I'm giving some consideration. I'm reflecting upon the fact that we may have some listeners here today who perhaps they themselves have a cancer diagnosis, or maybe somebody they know. Maybe they have a friend, a family member, neighbor, colleague who has a cancer diagnosis. And, maybe some of these folks are thinking about integrating naturopathic cancer care with conventional treatments. And hopefully, everything that you've shared with us today has given them some more insight into what that might mean, what the benefits are, and what that might look like. But nonetheless, for those listening to us today who maybe have never seen a naturopathic doctor for any condition, they may be a little bit hesitant. So to end off today, Dr. Standish, 2 questions for you. First of all, what would you say to these individuals that may be listening to us today? And secondly, where would you suggest that they go to access this research we're talking about that really demonstrates how very evidence-based naturopathic oncology recommendations really are?
Yeah. Back in 2004, almost 20 years ago, a group of naturopathic physicians, me included, realized that we needed to produce a specialization in naturopathic oncology, and that there's special training and special experience. And so we formed the Oncology Association of Naturopathic Physicians and developed a board exam and a curriculum. And so my advice to anybody out there is go to your internet and type in naturopathic physician, fellow of the American Board of Naturopathic Oncology, or FABNO, as we like to say, and find somebody in your state. Call them up and schedule an appointment. And now, not all states of the United States include naturopathic physicians in their medical system, but that's changing state by state. And then the other thing to do is to go, there's this wonderful website, the Oncology Association of Naturopathic Physicians, or ONC-AMP, as we call it, has a wonderful website for patients and providers. But the patient, there's a database that is very up to date. It's called KNOW, Knowledge. And so you can look up papers, science that relates to your diagnosis or your friend's diagnosis, and get some valid information. And I also, just to say one more thing, is I often find myself with patients who have looked and read on the internet about all kind, look up alternative medicines for breast cancer, and a huge deluge comes back, and much of it is probably, as I say in the clinic, BS. And you have to be careful. And so getting information from a valid source, I would go to the Oncology Association of Naturopathic Physicians.
Thanks for that, Dr. Standish, because it's so true that as I had mentioned earlier, there's just this deluge of research, especially if you put in a search term like the one you just mentioned, and that can make people feel overwhelmed. And I think just having you point us in these directions, so go on to the OncANP website, the knowOncology.org database that you mentioned. I've looked at this myself. It's a beautiful, beautiful site. There's all kinds of things that you can search by certain, naturopathic recommendations. You can see what the studies are, and you can ultimately, it's about making an informed decision. And you've made some really beautiful comments throughout this interview to indicate that that is one of the strong roles that naturopathic doctors can play in this world of integrative oncology, helping patients navigate. And that word is really important because, this world of cancer care can be like those rough, choppy seas, that you are having to navigate. And it's stormy and it's difficult and there's periods of calm. And, so I do foresee that these naturopathic doctors, such as yourself, that are really able to help patients navigate and make sense of this really complex world, of course, are incredibly valuable. Well, I wish we could talk further about this. There's so much more to say, but that's about all the time we have for today here. So again, Dr. Standish, thanks for joining us because you've told us, several things. You've given us a bit of insight into how naturopathic oncology research has evolved. You told us about Cusios, about that study, and how that's really adding some breadth and depth to the field of research and why that's important for patients. And of course, you've given us some great insight and a lot of really nice specific examples of what that might look like in terms of integrative oncology care that does incorporate naturopathic principles. And of course, the very solid and most importantly, evidence-based data that's behind that. Listeners, if you're wondering where you can find some of this info that we've described, the transcript and links to learn more about this and more about Dr. Standish's work will be in the podcast notes. And Dr. Standish, all this being said, are there any final thoughts you'd like to leave us with today?
Yes. One of the things that I've noticed, and I would feel myself, is when a person is diagnosed with cancer, there is this fear of missing the magic bullet. Like standing in the grocery store line and seeing a magazine article about cure your cancer today, with such and such. And I think naturopathic physicians, especially the board certified naturopathic oncology experts, can help you separate out the wheat from the chaff and help you navigate clinical trials, help you navigate what is a therapy that has no basis or has no evidence and might be dangerous. So naturopathic physicians, I think we're best in the cancer world for helping people not be afraid that they're missing the magic bullet. And by the way, I have not discovered a magic bullet. I'm still working on it.
Well, hopefully you'll let us know if you do.
I will.
And then that's another conversation. Well, thanks again, Dr. Standish. This is just a perfect place to end it. I really value your time. And of course, everyone, thanks for joining us as well. And we'll see you next time.